February is American Heart Month, where the focus has been on heart health information throughout the month. So we wanted to go ahead and wrap up this month talking about ways to be heart healthy. To do that this morning, we have Dr. Adrian Danchenko with us from Tennova Medical Group with the specialty he has in cardiology. First off, doctor, thank you so much for being with us today.
Thank you for having me.
You are welcome. So let's talk heart health and the best ways that we can make sure that we are living a heart healthy life.
Well, let's start out by kind of defining what we mean by heart health.
Okay.
When most people talk about the heart, they usually are thinking about this muscle in the middle of their chest. But really what we're talking about for the majority of people is coronary health. So we're talking about the actual blood vessels that supply blood flow to the heart itself. So it's mostly what we do in cardiology today, at least in this country, is we focus on coronary artery disease health. So the things we'll be talking about chiefly today will be speaking towards healthy blood vessels, or how to keep your arteries healthy and clean. So the major risk factors that we identify that lead to problems with the coronary arteries are numbered in about 7 or 8 different, other health-related conditions that lead to problems. And I like to look at them as what I consider the major risk factors for coronary disease, and then the minor risk factors. So the major risk factors we typically deal with, and things that typically lead to problems earlier in life, are number 1, diabetes, number 2, a smoking history, chiefly of tobacco, but certainly smoking anything other than tobacco is a problem, and then a family history. Diabetes is such a significant risk factor for the development of vascular disease that I tell most of my patients that it's really not a matter of if they're going to get vascular disease or coronary disease, it's a matter of when.
Right.
And then you really need to couch that by saying that just because you have coronary disease doesn't necessarily mean it's going to lead to some sort of problem in your lifetime that needs to be addressed, but it certainly is there. It's just with diabetes, it's we're dealing with an epidemic in this country at this point, and it's really which organ system is going to be mostly affected first, second, or third. But it's really the number one reason why people end up needing our attention, whether that be with stenting and bypass and other interventions. So the key is not to become diabetic. And that's where the typical recommendations you hear both from cardiologists and from your doctor is to maintain a healthy nutritional habit, and also to exercise regularly. 2 very simple things, but really if they could be ingrained in a prescription that you get from your doctor every time you visit them, that's what we would recommend. And it's all really to avoid becoming diabetic. Smoking speaks for itself. It has a variety of toxins in the smoke itself that damage the entire vascular space. So again, it damages the blood vessels that go to all of your organs. We tend to focus mostly on the lung effects because that's the most direct effects we see. But really, smoking is a very significant risk factor for any kind of vascular disease process, and is a major risk factor for both heart attacks and strokes for the same reason. It affects the vascular space, and it leads to this plaquing process that then leads to the heart attacks that we're concerned about. Right. And family history is important, but let's define that a little bit better, or a little bit more, fine-tuned as far as what we mean by that. What we're talking about chiefly is premature family heart disease, risk. So if mom or dad or grandma or grandpa had heart disease or diagnosed early in life, and we couch that by saying that it's typically today we think of anything less than 60 years of age, if they required some specific intervention, stenting, heart attack, bypass surgery, that's early under the age of 60. But it needs to be compared to the other risk factors, and looked at with the other risk factors that they had. So if both of your parents, for instance, were diabetic, or both of them were smokers, or they were both diabetic and smokers, we really can't look at the family history in isolation in that particular instance, right?
Right.
Because they have these other major risk factors. And so we really don't know how much contribution the genetic profile has in that particular instance. So those are really the three major risk factors, that we focus on and that we're concerned about, especially with the development of coronary disease early in life. And the things we really, advocate and recommend, individuals avoid if at all possible. There's a lot of other risk factors. I kind of couch these as what I consider lesser risk factors, only because they're important, but they typically don't lead to significant vascular disease early in life. These are things that take many years to develop. It takes a long time for them to exhibit the negative effects on the vascular space. And so we do want to attend to them. We do want to treat them. But again, it takes many, many years, and in most cases, many years of inattention or poor treatment of those conditions that leads to problems. And those are things like hypertension or persistently elevated blood pressures, high cholesterol values, specifically high LDL values, which look at, what your gender is. We certainly can't change those things. So it's something we factor into the equation, but it's not something we can change, so we don't focus on it. And then, of course, being overweight or obese and being sedentary also contributes to, vascular disease.
Right.
But, hypertension and hyperlipidemia is where we focus a lot of the attention because, again, it's something we can measure. It's something we can treat. There's a multitude of medications out there to, facilitate appropriate treatment of those risk factors. And so that's what we focus on. And typically, again, probably not in my office necessarily, as far as an initial diagnosis or initial treatment. Usually that's handled by the internist. But certainly everybody who has diagnosed coronary disease is going to get treated for those in a much more aggressive fashion.
We are not done with the topic of heart health. We have more with Dr. Danchenko when we come back. Welcome back to Mornings on Main Street. We pick up once again with Dr. Danchenko on how to stay heart healthy. I want to ask a couple questions. And from your standpoint, when you say a healthy diet, what do you say a healthy diet is?
Yeah, a healthy diet, there's a lot of misinformation out there today about these different diets and diet fads. And one can even look back at the original diet recommendations, the pyramids, the circles, and I don't know what the latest one is, to be honest with you.
It's always changing.
Those are not really 100% correct. Okay. There are a lot of the initial dietary studies were done and they were, for lack of a better way of putting it, they were poorly done. And what was done in those studies that was a mistake was that they didn't really look closely at the sugar intake that people were consuming in their diet. They looked at saturated fats, they looked at proteins, they looked at carbohydrates, but for some reason the sugar aspect it wasn't factored in. So that when a cardiologist talks about a heart healthy diet, what he's talking about is a diet that is very similar to what the diabetic doctors recommend today. And that's a diet that is low in carbohydrates, very low in simple sugars. So, simple things like sodas that have sugar in it, pastries, desserts of any kind that have sugar in it. Those should be consumed rarely. I mean, these are things that are very, for lack of a better, very bad for you. I mean, we're going through a massive experiment as far as, people on this planet goes with the readily available access to sugar that we've never experienced before leading to this diabetic epidemic. When you have such readily available access to refined sugars and to carbohydrates, mind you, that's why we're running into all the problems we are. So a heart healthy diet would be one that's high in vegetables. Protein is okay, as much protein as you like. Even saturated fat, which has been kind of vilified over the years as a major, contributor to atherosclerosis disease or to vascular disease in general, really isn't that bad. Okay, we consume saturated fat, but it's not as if saturated fat is simply converted into plaque the minute we consume it. We need saturated fat. Saturated fat is an important energy source. Our heart actually uses saturated fat as its primary energy source. It doesn't use sugar or carbohydrates. And that's because it's readily available and it doesn't create an acidic environment when saturated fat is utilized as an energy source. So saturated fat is not as bad as people make it out to be. But really what you want to focus on is a protein and vegetable-based diet. Even fruits are okay, but again, in moderation. If you eat the fruit, you want to consume it in its natural state.
Yeah.
Juicing, and again, this fad that came up several decades ago of juicing, and this was somehow supposed to be healthy for you. It really is not. It really is just a different form of a sugar. You shouldn't be consuming or eating a lot of or drinking a lot of juices if you are if you want to stay healthy or if you're a diabetic, especially, because it's just a different form of sugar, but it's still sugar. Okay. So if you're going to consume fruits, eat it in its natural state, and certainly don't overindulge in it, because in a lot of ways, it's sort of like having a dessert. You want to minimize that intake.
Couple final questions. One being artificial sweetener. A lot of people saying, okay, I'm not taking in a lot of sugar. I use something that, the artificial sweeteners. Is that okay? Or do you recommend just cutting that out too?
I don't recommend artificial sweeteners, and for several reasons. One is it sets up kind of a bad metabolic reaction, for lack of a better term. Without getting into all the specifics, it's sort of like you're trying to fool your body into thinking that it has recently consumed some sugar. And so when that artificial sweetener hits your taste buds in your mouth, there's a series of signals that get sent off to your gastrointestinal tract and to your metabolism to say, oh, there's simple sugar on its way. Let's get ready. We're going to process this. We're going to take care of it. And when that doesn't happen, there's a series of things that can get set up to suggest that your body is being starved. Okay. So it's ready for this onslaught of sugar. It doesn't happen. And all of a sudden, the body seems like it's being starved, meaning that's how it's going to respond. So what it does then is it starts setting up a chain of events. And this happens over many different meal times and many different weeks and months and so on and so forth. But if the body is perceived as being starved, what it'll do is it'll retain adipose tissue, meaning it'll store fat because it fears that there's some sort of problem coming around the bend and it's not going to have enough energy, so it starts storing fat. And so it sets up this counterproductive pathway if you're using a lot of artificial sweeteners.
Got it. Thank you so much for all of this information. I really hope people are listening to what you're saying. Is there anything that I haven't asked you that you feel like people need to hear?
Well, again, I think it kind of goes back to the very beginning of the discussion that we held with regard to the recommendations for diet and exercise. Many times, every time that I speak to patients about this, I try to make them understand the value of those two things. And I'm going to focus just briefly on exercise because we've talked a little bit about diet. Exercise is such an inherently important facet of our health, not just from a cardiovascular standpoint, but in general, that it's really, you can't oversell it. Okay. And I think a lot of times in our doctor's offices, it is undersold. And it's because historically people are looking for a simple, quick fix that doesn't require any exertion or any kind of effort on their part or any discipline to do the exercise. I mean, aside from the cardiovascular benefits of exercise, simply doing regular motion-related exercises, even if it's walking, even if it's Tai Chi, something like that, these are things that help kind of lubricate our joints. They release endorphins. They make us feel better. And all of those things simply lead to a better overall health. So it isn't just the aspect of the caloric, burning of calories or trying to lose weight. There's a lot of other benefits to the exercise. And it's very important that we engage in that on a regular basis, if not every day, at least every other day. Because today, unfortunately, it's become very easy to become entirely sedentary. There's not one bit of physical activity most people have to do on a daily basis, especially today in this country. You can manage to spend your entire day not doing one bit of exertional physical activity. That's not healthy.
Thank you so much for all of this. Dr. Danchenko, we appreciate your time. Again, cardiologist with Tennova Medical Group. We appreciate you. Thank you again.
Thank you for having me.
Anytime. Stay with us here on Mornings on Main Street. We'll be back with more after this.